Hey everyone, and welcome to today's episode of AI in Everyday Life, the podcast where we dive into the cutting edge world of artificial intelligence and its impact on our lives.
Hello to all our listeners out there. Today, we're tackling a topic that's been making waves across industries, artificial intelligence. But we're not just talking about AI in general. We're zooming in on healthcare.
That's right. AI in healthcare isn't some far-off sci-fi dream anymore. It's already here, and it's changing the game in ways that might surprise you.
Well, it's simple. AI has the potential to save lives, improve patient outcomes, and even make healthcare more accessible. But here's the thing. It's not just about robots performing surgeries or computers replacing doctors. It's way more nuanced than that.
Exactly. And today, we're going to break it all down. We'll talk about what's already happening, what's working, and maybe even what's not. So buckle up, because this is the truth about AI in healthcare. What's already happening?
All right, let's start with the basics. When we say AI in healthcare, what exactly are we talking about?
Great question. AI, or artificial intelligence, refers to machines or software that can perform tasks that typically require human intelligence. In healthcare, that could mean anything from analyzing medical images to predicting patient outcomes, or even helping with administrative tasks.
Right? And it's not just one thing. AI in healthcare is a whole ecosystem of tools and technologies. You've got machine learning, natural language processing, robotics, and more. But the common thread is that these tools are designed to make healthcare smarter, faster, and more efficient.
And let's not forget, AI isn't here to replace doctors. It's here to assist them. Think of it as a super smart sidekick that can crunch numbers, spot patterns, and provide insights that humans might miss.
Exactly. And that's where the real magic happens. When you combine human expertise with AI's capabilities, you get this powerful synergy that can lead to better care for patients.
But let's not get ahead of ourselves. Before we dive into the cool stuff, let's talk about how AI actually works in healthcare.
Sure thing. At its core, AI in healthcare relies on data. Lots and lots of data. This could be patient records, medical images, genetic information, or even data from wearable devices like fitness trackers.
And then, using machine learning algorithms, AI systems can analyze this data to identify patterns, make predictions, and even recommend actions. For example, an AI system might analyze thousands of X-rays to learn what a healthy lung looks like versus one with pneumonia.
Exactly. And the more data the system is exposed to, the better it gets at its job. That's why AI is so powerful. It can process and learn from vast amounts of information much faster than a human ever could.
But here's the kicker. AI isn't just about speed. It's also about precision. In some cases, AI can detect subtle patterns that even the most experienced doctors might miss.
Which brings us to the real-world applications. Let's dive into those next.
So, let's get into the nitty-gritty. What's already happening in the real world?
Oh, there's so much to talk about. Let's start with diagnostics. AI is already being used to analyze medical images like X-rays, MRIs, and CT scans. For example, there are AI systems that can detect early signs of diseases like cancer, sometimes with accuracy that rivals or even surpasses human radiologists.
That's incredible. And it's not just about spotting diseases. AI can also help with personalized treatment plans. By analyzing a patient's medical history, genetic data, and even lifestyle factors, AI can recommend treatments that are tailored to the individual.
Absolutely. And then there's predictive analytics. Hospitals are using AI to predict things like patient admissions, readmissions, and even potential complications. This helps healthcare providers allocate resources more effectively and intervene before problems escalate.
And let's not forget about administrative tasks. AI is streamlining things like scheduling, billing, and even patient communication. Chatbots, for example, can handle routine inquiries, freeing up staff to focus on more complex tasks.
It's amazing how much is already happening behind the scenes. But here's a question, Alex. What about the challenges? AI sounds like a miracle worker, but it's not perfect, right?
Oh, absolutely. AI in healthcare isn't without its challenges. One of the biggest concerns is data privacy. AI systems rely on massive amounts of data, and that data often includes sensitive patient information. So, there's a huge responsibility to protect that data and ensure it's used ethically.
And then there's the issue of bias. AI systems are only as good as the data they're trained on. If that data is biased, say it doesn't include enough diversity, the AI could end up making biased decisions. That's a huge problem when we're talking about something as critical as healthcare.
Exactly. And let's not forget about the human factor. Doctors and nurses need to trust AI, and that means the technology has to be transparent and explainable. If an AI system recommends a treatment, healthcare providers need to understand why.
And then there's the question of accessibility. AI has the potential to make healthcare more equitable, but only if it's deployed in a way that reaches everyone, not just those in wealthy countries or urban areas.
So, while the potential is huge, there's still a lot of work to be done to ensure AI is used responsibly and ethically in healthcare.
All right, let's take a step back and look at the big picture. Where is all of this heading? What does the future of AI in healthcare look like?
I think we're just scratching the surface. In the near future, we could see AI playing a bigger role in preventive care. Imagine wearable devices that monitor your health in real time and alert you to potential issues before they become serious.
And then there's the potential for AI to revolutionize drug discovery. Developing new medications is a long, expensive process, but AI could help identify promising compounds faster and more efficiently.
Plus, as AI gets better at understanding natural language, we could see more advanced virtual health assistants. These could provide personalized advice, remind patients to take their medications, and even offer mental health support.
It's exciting to think about, but it's also important to stay grounded. AI is a tool, not a cure all. It's up to us humans to guide its development and ensure it's used in ways that truly benefit patients.
Well said, the future of AI in healthcare is bright, but it's also something we need to approach with care and responsibility.
Before we wrap up, let's address a question we received from one of our listeners. Sarah from Chicago asks, how can I, as a patient, benefit from AI in healthcare right now?
Great question. The truth is, you might already be benefiting from AI without even realizing it. For example, if you've ever used a health app that tracks your steps, heart rate, or sleep patterns, that's AI at work.
And if you've had a recent medical scan, there's a chance AI was used to help analyze the images. Even something as simple as a chatbot on your hospital's website is an example of AI in action.
So, while the flashy stuff might still be on the horizon, AI is already making a difference in everyday healthcare.
And for those of you who are curious about how to get more involved, don't be afraid to ask your healthcare provider about the tools they're using. The more informed you are, the better you can advocate for your own care. And that's a wrap for today's episode of AI in Everyday Life. We've covered a lot of ground, from the basics of AI in healthcare to the real world applications and the challenges we still need to address.
Thanks for joining us on this journey. If you enjoyed this episode, don't forget to subscribe, leave us a review, and share it with your friends.
And if you have any questions or topics you'd like us to cover in future episodes, drop us a line. We'd love to hear from you.
Until next time, stay curious, stay informed, and keep looking to the future.